I'm Dr. Sharif Negm, instructor in CoNNect Academy, MD, FRCP, consultant in internal medicine and endocrinology. MRCP is an internationally recognized medical degree. It is a postgraduate medical diploma in the United Kingdom. This qualification is designed to test the skills, knowledge, and behavior of doctors that all patients want their doctors to have. The MRCP diploma has been approved by the General Medical Council as a knowledge-based assessment for core medical training. It enables you to enroll in the specialty training program through the MTI program, so you can register in the GMC through the MTI program, or you can immediately search for a job through the GMC registration. So why MRCP? MRCP holder is given a higher status and pay in Gulf countries as well as in other Asian and European countries. Besides, the MRCP is the shortest way to a successful career in medicine. So don't hesitate. There is an immense amount of jobs in the United Kingdom right now, and it also gets to Gulf and easy to get prepared. So about the first part of MRCP, it tests the acquisition of a representative sample of medical knowledge, skills, and behavior of the doctor. A broad range of topics is covered to ensure the knowledge is appropriate. The exam is available to the postgraduate with a minimum of 12-month training experience in the medical field. Internship is accepted, so after you finish your internship, you can enroll for the MRCP first part exam. Permitted number of 6 attempts for each part of MRCP exam. The purpose of the first part exam is to test knowledge and understanding of common and important disorders. Questions on clinical science are set in clinical context to emphasize the practical importance of the information being tested. Success indicates that your knowledge of medicine has expanded and kept pace with updated guidelines in different sections in medicine. So how to apply? You need the primary medical qualification, photocopies of certificate, and official translation in English will be accepted. It may also need authenticated by the medical school or the British Council. And you can pay using either the credit card or the bank draft. About the exam, it is 1-day examination, 2 3-hour papers, 100 multiple choice of best of 5 types questions per paper, so 100 best of 5 questions per each paper. There is no images, no ECGs. It's set in the clinical context. So what about the MRCP Part 2 written examination? It will test the ability to apply clinical understanding, make clinical judgments, and take responsibility for diagnostic or problem list, planning investigation, selecting a plan for immediate management, selecting a plan for long-term management, assessing the prognosis of the disease. The MRCP Part 2 clinical examination, especially when going to the PACES exam, it will test the following skills: physical examination, identifying the physical signs, clinical communication skills, the differential diagnosis, the clinical judgment, managing patient concern, and this is a very important part, and managing the patient welfare. You will be able to treat your patient in a completely different behavior. So what about the format of the first part of MRCP? In rheumatology and endocrine, cardiology, neurology, the gastroenterology, the nephrology, and the hematology and infections, all these parts will be 15 questions. According to the pharmacology and toxicology, it's 16 questions. The clinical science is 25 questions, and we will talk about the format of this. The dermatology and psychiatry, each of them is 8 questions, and the geriatric is about 4 questions with the ophthalmology. So what about the clinical science? The format of the clinical science: 2 questions for biology, 3 questions for clinical anatomy, 4 for biochemistry and physiology, 3 questions for genetics, 4 questions for immunology, and 5 for the statistics. So what about our course? In CoNNect Academy, the course will be conducted through 24 sessions, once weekly, maximally about 4 to 5 hours per session. A thorough discussion for all parts of medicine, including illustrative picture and diagrams and the clinical background of the disease, which being explained, MCQ training and the tracks explanation for the MCQ, mock exams done every 3 chapters, and including the question bank and ECG interpretation and explanation. Through 9 years of teaching experience and 2 years as an international examiner in the Royal College of Physicians for the PACES exam, CoNNect Academy will ensure that you will pass the first part of the MRCP. It also will provide you with all the materials that you will need, the sites that you will need to solve, also cyclic mock exams each 3 branches, a simulator exam at the end of the course. There will be active WhatsApp group for solving the questions and sharing experience. Don't hesitate. If you want to inquire about anything, please contact us. We are very happy and we are here to help you. Thanks.